Okay, so now we're going to do room breakdown. So Professor Monk, right after the procedure is done, the first thing we want to do is run our water lines. So water lines, when we talk about water lines, if you see she picked up the air water syringe. Water lines are what comes, where the water comes out of, okay? So we want to make sure that we're doing our air water syringe. So she's just going to use her suction to do that in. So we're going to turn on the suction. She's going to run the water into the suction for 20 seconds. Okay, so in between patients is 20 seconds. Remember, in the morning, it's 2 minutes to flush it down. But in between patients, we want to run the water lines for 20 seconds. Okay, so she runs that water line. Then right then, she's just going to take off her tip. So with the tip, you want to push in that yellow button there. If you see her, you're going to pull in that yellow button and pull the tip out. That goes on the tray. She's going to pull off her suction. Good. And then we're going to pull off the saliva ejector. Perfect. Now this barrier that was over here, this is a good protection to help keep those little holes in there or little divots clean. But usually that barrier doesn't stay on. So we're just going to lift that up and go ahead and place these back in. We're going to wipe that because that barrier does move. All right, so she's going to come to the other side. And now on this side, we need to do the handpiece. That's the only water source that we have on the doctor's side. We did not use the air water on this side, so we don't need to run that. We just need to run this one. So what she's going to do is we have a cup because our air water or high speed doesn't reach over to the sink to do it in. So we're going to do it in a cup. So she's going to remove the handpiece first. Let's remove the handpiece first because a handpiece is going to get processed and flushed in the sterilization area. So if you see, she's twisting that outer knob there. You just twist that outer section and pull. Okay. So now we're going to flush that line down. So what she has to use is the rheostat. Remember that little pedal that we saw before right here? So we're going to use that pedal and we're going to flush this line for 20 seconds. That gets all that water out of that line. All right, so what happens with the handpiece is that sometimes when the doctor lets up on the rheostat, it actually sucks back a little bit. So we want to clear that line. Same thing as the suctions on the other side. We're going to just go ahead and place it in that little space there because we're going to wipe it anyway. So now what she's going to do is remove her barriers. So when you remove barriers, you want to make sure that you're kind of turning that inside out. You don't want to touch the surface underneath. If she did touch the surface underneath, then we would have to clean and disinfect that area. So she's trying to pull them off without contaminating them. So we have those barriers. Let's toss those in the trash. Good, everything is on her tray. So she's going to pick up her tray and fold up this barrier. You want to kind of fold it up inside out. Perfect. And then she's going to drop that in the trash on her way to the sterilization area. So we're going to walk to the sterilization. Perfect. And then we're going to place our tray in the contaminated area. You see the red there? So it's going to go in this rack right here. And that's going to stay there for processing. So now she's done. She's going to remove her gloves. Remember, we're going to pinch one of them, turn it inside out, use that glove to pinch the others, the other one, turn it inside out, right into the trash, and then immediately hand hygiene. There we go.